Diphenhydramine is used to relieve symptoms of allergy, hay fever, and the common cold, such as rash, itching, watery eyes, cough, runny nose, and sneezing. It can also help prevent and treat nausea, vomiting, and dizziness caused by motion sickness. It works by blocking certain natural substances in the body, like histamine, which is produced during an allergic reaction. It can also help you relax and fall asleep. This medication is not recommended for use in children under 6 years old, and some forms are not recommended for children under 12 years old. It's important to follow the dosage directions carefully to avoid serious side effects. Additionally, do not use this product to make a child sleepy, and avoid giving other cough and cold medications with similar ingredients. Always consult your doctor or pharmacist for more information on using this product safely. When taking Unisom Sleepmelts, it's important to follow the directions on the product package or as prescribed by your doctor. The medication can be taken in tablet, capsule, or liquid form, with or without food. If using the liquid form, be sure to measure it using a special measuring device to ensure the correct dose. The dosage of Unisom Sleepmelts is based on your age, medical condition, and how you respond to the treatment. It's essential to read the dosing instructions carefully for each product, as the amount of diphenhydramine may vary between different brands and forms. Do not increase your dose or take the medication more often than directed. If you're taking Unisom Sleepmelts for motion sickness, it's best to take your dose 30 minutes before starting the activity. For sleep assistance, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, it's important to contact your doctor. Be sure to inform your doctor if your condition does not improve or if it worsens. Some common side effects of Unisom Sleepmelts include drowsiness, dizziness, constipation, stomach upset, blurred vision, and dry mouth/nose/throat. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as mental/mood changes, difficulty urinating, fast/irregular heartbeat, or seizures. A serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you have any concerns about the side effects of Unisom Sleepmelts, don't hesitate to consult with your healthcare provider. Before taking Unisom Sleepmelts, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. Unisom Sleepmelts may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. If you have diabetes, liver disease, or any other condition that requires you to limit sugar, alcohol, or aspartame, it's important to talk to your doctor or pharmacist before using Unisom Sleepmelts. Children and older adults may be more sensitive to the side effects of this medication, and it's important to use caution when using Unisom Sleepmelts during pregnancy or while breastfeeding. As always, it's important to discuss the risks and benefits with your doctor before using this medication. When taking Unisom Sleepmelts, it's important to be aware of potential interactions with other medications. This could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Unisom Sleepmelts include antihistamines applied to the skin, as well as other products that cause drowsiness such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It's important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using those products safely. It's also important to note that Unisom Sleepmelts may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you use this drug. If you suspect an overdose or someone has serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, mental and mood changes such as restlessness, irritability, and hallucinations may occur before drowsiness. Remember to take Unisom Sleepmelts as directed by your doctor or pharmacist. If you have any questions about the proper use of this medication, consult your doctor or pharmacist. Do not increase your dose or take this medication more often than directed. Do not take this medication for longer than recommended. If your condition persists or worsens, or if you think you may have a serious medical problem, seek immediate medical attention. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one as usual. Don't take a double dose to make up for the missed one. When it comes to storing Unisom Sleepmelts, it's important to keep them at room temperature and away from moisture and light. It's best to avoid storing them in the bathroom and do not freeze the liquid forms of this medication. And of course, always keep all medications out of reach of children and pets. When it comes to disposing of Unisom Sleepmelts, it's important not to flush them down the toilet or pour them into a drain unless instructed to do so. It's important to properly discard this product and it is expired or no longer needed. If you're unsure about how to properly dispose of Unisom Sleepmelts, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.